I heard you mention your time at the Virginia Commonwealth University as well as the Virginia Treatment Center for Children. Do you mind expanding on like your experiences at both the Virginia Commonwealth University and the Treatment Center for Children in your time at the PhD program?
Absolutely. If you asked me why I attended VCU, the honest answer is because that's where I got in. I applied to approximately 15 PhD programs in clinical and counseling psych. And in the final analysis, I was waitlisted at VCU, Notre Dame, and Indiana University. And thankfully, the student ahead of me at VCU that was selected ahead of me opted to go elsewhere. And so I was able to match with, I think, the professor that was the best fit for me, somebody with similar background to me at VCU, was granted admission into that program. And I really think it was the perfect fit, in as much as that I was in a program that was a PhD in clinical psych with a concentration in child and adolescent, with children and adolescents. And the cool thing about the program was that I was able to delve into that area, both in terms of research, evaluation, and treatment, while also overlapping with the counseling psychology program at VCU. And so, to their credit, they allowed for sort of an intermingling between both programs, and I think it allowed to round out both formal coursework as well as exposure to psychologists from different walks of life. So in any given semester, I was taking classes, doing research, doing individual consultation with private practice psychologists, counseling psychologists, clinical psychologists, some that were more research oriented, some that were more clinical oriented. And so it really offered me an expansive sort of set of experiences with different kind of psychologists that help inform who I am. It really informed who I didn't want to be, because there was just so much one-on-one contact with the faculty that you really got to learn, like, what kind of psychologist, what kind of way you wanted to work, and what kind of way you didn't want to work. And an extension of that was the internship at the Virginia Treatment Center for Children. I had completed a practicum there prior to internship, and it really was a nice fit, where it's an inpatient psychiatric hospital within the larger teaching hospital at VCU, and it was all things inpatient related care. So patients that tended to have a kind of more severe forms of pathology, they tended to be there for whether it was reasons of self-harm or psychosis or severe mood disorders, or homicidal ideation or homicidal acts. And so it really allowed me to plunge into the deep end of the pool and work in an intensive and extreme sort of setting with, again, a team of psychologists and psychiatrists and social workers, et cetera, and in a multidisciplinary setting, and to really have a traditional multidisciplinary experience within a teaching hospital.